Hello, everybody, and welcome to another episode of the Surdentity Podcast. I am your host, Elizabeth Dewar Anthony, and today I have with me the queen of dental hygiene, Barbara Tritz. And I'm very excited to be talking to her. She's a leader in our field in terms of biological dentistry, microscopy, bacteria evaluation, all that stuff. So we are going to get down to it. Good morning, Barbara. It's morning there. It's still
It, it is still morning here. It's dark
yeah,
and gray.
right. You're where are you? Are you in California?
No, I'm in the Pacific Northwest,
Oh, yeah.
just outside of Seattle.
So we're in opposite ends of the country. I'm in the Florida Keys.
Ah, lovely,
Yes, it
lovely.
is. It is lovely, and it's sunny today. And we've fared so far so well with all this hurricane uh,
Good.
stuff. So I'm very blessed. But I was looking at your blog this morning, and I read you when you got into this, and the same as me, we wanted to help people and we
Mhm.
wanted to be healers.
Yes.
Healers. And you know, I many years ago I was advised to read Peace, Love, and Healing by Dr. Bernie Siegel, who is a cancer patient advocate. And it was a great book, but it really spoke to me as a healthcare provider in terms of how we approach the people who come to us for care.
I
Um,
know.
and I'm so over reading these rants on Facebook about like these rude patients. Oh my God, this patient came in, she was so rude. And my whole thing is, first of all, we're supposed to do no harm.
Mhm.
So when a patient comes in and they're acting out like that, 9 times out of 10, they have been harmed.
Mhm.
Okay. They are reacting to their lived experience, which is when I go to the dentist, I get harmed.
Yep. It hurts. It
It
hurts.
hurts and I can't breathe. That's really the bottom line is I can't breathe. And I didn't realize that until I became a myofunctional therapist.
Mhm.
I've known for 30 years that there was a post-traumatic stress reaction going on.
Mhm.
But it wasn't until I 2018 that I was like, oh my God, it's the airway.
Yeah.
When you can't, not being able to breathe is the most frightening human experience.
Mhm.
So, you know, the patient comes in, they're a mouth breather, and we throw them in our chair and we start to put a bunch of stuff in their mouth. If they can't breathe, there's no way that it's going to be a positive experience for them.
Exactly. And we have not been trained to look beyond the teeth and gums. We
Mm-hmm.
aren't assessing the facial development, the throat, the tonsils, the allergies, the snotty nose, the clogged nose. Our poor little kiddos can't breathe, they can't chew, they can't
Yes.
swallow.
And
And
pediatric offices now, they're like Disneyland. I mean, there's nothing uh, that's frightening about them, but kids are still being traumatized because they can't breathe.
mhm, yeah. Yeah, I wish that myofunctional therapy and myofunctional disorders were part of our curriculum.
Mm-hmm.
It should be. It shouldn't be an afterthought. It shouldn't be a, you know, training if you feel like it afterwards. It needs to be front and center because if we're not
Absolutely.
breathing, we can't grow a healthy face, we can't grow a healthy child, and we can't grow
Absolutely.
into a healthy adult.
Yep.
It is a failing of our profession.
Yeah, and like you were saying, dental hygiene, we're still doing the same thing that Irene Newman did. Okay.
Mhm.
Maybe a little faster, but
Yeah, but not better.
not better. And
No.
there needs to be a complete paradigm shift in our approach. We need to
Mhm.
stop with the tartar
Yeah.
and probing. Oh my God.
Oh, Elizabeth, you're speaking my language.
Per- uh,
Yay.
Periodontal probing is subjective, right? And it's cruel.
Yeah.
And
Yep, it is.
the information you're getting is what?
History. It's just history. And it doesn't prove that disease is active. It doesn't prove that you're going to lose more bone. That's where salivary diagnostics, phase contrast microscopy, that's where it plays a really critical role. I mean, I can look at a 5-year-old, and if I take plaque sample from a 2 millimeter pocket or a 1 millimeter pocket, and it's full of spirochetes or amoebas, and I've seen that in 5-year-olds, then I know we have a crisis on our hands.
Wow.
And you can have, a bad microbiome in a 1 millimeter pocket. Or you can have a healthy microbiome in an 8 millimeter pocket. So the pocket itself doesn't mean anything.
Mm-hmm.
And, like you said, with calculus, we are spending 90% of our time on 10% of the problem. And that's how we're graded in dental
Right.
hygiene. Yeah. I mean, we can't pass our boards and we can't move on to the next year if we've left calculus behind. And
Oh,
that is so 20th century. I
right.
mean, we have to become the healer. We have to look at why we have calculus. What nutritional deficiency do we have? What is going on in the body, in the
Mm-hmm.
gut, in the absorption, and in mouth breathing, and in our salivary flow? We are not looking in the right places to heal this infection, this disease.
Mm-hmm.
And, you know, it's uh, and then we're not looking at emotions and toxicity. We're putting so many toxins in our patients' mouths. It just makes me crazy.
So I see you posting about the F word, floor, and that's still heresy. That is still
I
heresy. In
um,
in Metabolical by a wonderful book. And who the hell I met the dude and I had him autograph it. What's his name?
Lustig.
Yes. So he talks about how when fluoride was like the great panacea for
Mhm,
dentistry, and we stopped everything else that we were doing.
mhm,
Prior to the emergence of fluoride, this, we were talking about diet. We were talking about general health. And then
mhm.
fluoride came along. It's like, oh, great.
Yeah.
And
And
we've
then we
been
threw that
brainwashed.
Band-Aid on, and then we just admonish people to brush more, floss more, which doesn't work, and fluoride, more fluoride, stronger fluoride, more often, and you need more fluoride in your water,
Mm-hmm.
and fluoride fluoride is everywhere. Fluoride is in our medications, it's in our food that's watered with fluoridated water, it is in our drinks, it is in our medicines, it's in our Teflon pan, it's in our pesticides, and it's in every dental product.
Mm-hmm.
Yet tooth decay is still at epidemic levels.
Right.
And fluoride is just a Band-Aid. It makes us feel good in the profession, but it doesn't address the root of the problem. And as
Yes.
a biological hygienist, that's what I want to do, is dig deeper.
Yes. Oh my God. Yes. And when we're digging deeper, there's also, I call it the 3S system: slam, shame, and sell. You slam the patient in the chair, you shame them for their oral hygiene, and then you sell them products from the office.
Yeah.
And there's just, it's got to stop,
Yeah,
because
it
then
does.
people leave. My philosophy, my core practice thing is, nobody is going to leave my chair in pain and ashamed.
Yeah.
They might be
Nice.
uncomfortable, but they're absolutely not going to be ashamed.
Yeah.
And it's, why do people still get the idea that dental disease is some sort of moral failing?
Yeah. No, It is a breathing issue, it's a pH issue, it's a nutrition issue, it's a leaky gut issue, it
Mm-hmm.
is an emotional issue, but it is not, prehistoric man didn't have a hygienist running after him telling him
Right.
to floss.
They didn't even
Imagine
think about it.
that. Yeah.
They just
And
lived their lives.
yeah. And they had healthy plaque, and there is such a thing as healthy plaque.
Mm-hmm.
And we need plaque because it has a job to do. And it buffers the acids, it remineralizes the teeth, it protects the roots. So
Mm-hmm.
we are so focused on getting every speck of calculus and plaque off, we're missing the forest for the trees here.
Mm-hmm.
So it is, we have to look beyond that. We have to educate ourselves on airway, on nutrition. We get one semester of nutrition, and
Right.
it's about, the government, three things on the plate,
Oh, right, right.
and low fat. It's like,
Right. Oh my God. So we were both in hygiene school in the 80s.
yeah,
And that was the low fat was it,
yeah. Oh my God. And that's why we have this resurgence in tooth decay, because nobody's eating fat.
right? And it's sugar. So if you take the fat out, you have to replace it with something. And
Mhm.
along with tooth decay, diabetes, obesity,
Yeah.
heart disease, these are all things that are in the same trajectory. And it's interesting when you look at the uh, the emergence of Starbucks, Dunkin' Donuts, Tim Hortons. America runs on Dunkin', but so does people blood sugar. I mean,
Yeah.
if you look at a chart over here of opening of Dunkin' Donuts and franchise growth, and then
Mm.
you look at diabetes and obesity,
Mhm.
they're going.
Yeah. Yep.
We're eating more and more with nothing to show for it except disease.
Yeah. Exactly. And, as dental hygienists, I think that we play a really important role in helping people make better food choices,
Mm-hmm.
and setting, because they see us more than any other healthcare
Yes.
provider.
Yes.
And it's up to us to be healthy, to eat healthy, and to educate on nutrition.
Yeah.
And I looked at, I work in a biological office now, so we have no sugar in the office. There People don't bring us donuts, they don't bring us cookies. They, unless they're healthy cookies made with monk fruit and
Mm-hmm.
almond flour.
Right.
But I mean, when I worked in allopathic dentistry
Oh,
for
right.
years, I mean, our snack room, our break room had more ghee dunk than the corner store,
Right. And Christmas
and
time,
Diet
yay.
Coke. Oh, you know, my office manager, she would drink 3 Diet Cokes a day. And I still, to this day, when I hear a soda pop can open, it's like it gives me PTSD,
No
because
kidding.
oh my gosh. And then she's wondering why her teeth are sensitive. It's like, well, oh,
Mm-hmm.
surprise. We're
Right.
bathing them in acid. And we've got to walk our talk. We
Mm-hmm.
have to, as a profession, up our health level.
Yeah.
We owe it to our patients. I mean, that's part of being a healer, is heal yourself.
Yeah.
Look at how you can better yourself. Exercise, and not do toxic things and put toxins in your mouth. If if something has a warning label to call poison control, why are
Right.
we putting it in our mouth or our patient's mouth?
Right.
I want to cry. The
Yeah.
ingredients in commercial toothpaste,
Oh,
sodium lauryl sulfate, ruins the mucosal tissue. Propylene glycol, why is that in our mouth? And then, as you mentioned, fluoride. Fluoride is a neurotoxin. And I mean, it says on the label, if you swallow too much, well, how much is too much? It
right.
doesn't say that on the label. but
Mm-hmm.
one pea size of fluoride toothpaste has the same, it's a quarter microgram of, uh, I don't have the right,
Right. It's okay.
but anyway, it has the same as in a glass of water.
Wow.
Okay. And we're giving babies how many bottles a day of fluoride?
Right. Oh my
And
God.
so, think about I've had patients before I knew better who would, when I'd put the foam fluoride trays in, and they would
Hmm.
suck it dry and they would swallow it.
Yeah.
And then within 20 minutes, they would be running to the bathroom to throw up.
Wow. Hmm.
And because I wasn't paying attention. So shame on me. But if you're swallowing that amount of fluoride and it is causing you g- pain, stomach ache, and nausea and vomiting, and then we're putting that amount of fluoride in a baby 3 or 4
Hmm.
times a day in a bottle, you know, that fluoride attacks the gut lining. And so it can cause, it causes leaky gut. It causes
Wow.
damage to the microvilla. And
Wow.
there's research. I've got it from the CDC in their report. And just think about, all those babies that have colic-like symptoms. What
Hmm.
if it's because we're poisoning them with fluoride?
Oh my God.
I
That's
know.
really mind blowing.
Yeah. And I have the research on it. So, it's we have to look at our products. And instead of putting chemicals in, let's work with the body. Let's work with nutrition. Let's heal the gut. Let's have good food. Let's take sugar out of our diets.
Hmm.
And here's the other thing that nobody really talks about is it it doesn't, I mean, we can have bacteria. There's good bacteria in our
It's
mouth.
there. We have to have
It's
it.
supposed to. But what sugar does is sugar stops the dental tubule flow. All right. And our teeth are like a tree sap, and it's,
Hmm.
going out. And there's fluid that comes out of the teeth into the mouth. It's microscopic, but it's constantly flowing this way.
Wow. Okay.
Okay. But sugar stops that dental tubule flow.
Oh my
So
God.
now you've got the backwash from the acids in the mouth going down the tubules. And that's where decay comes from, because
God.
we're not absorbing our fat soluble vitamins because of leaky gut, or we're not getting enough fat soluble vitamins
Hmm.
because we aren't eating a good, well balanced diet.
Right.
Fat soluble vitamins feed the odontoblasts. And so if you've got odontoblasts that are not healthy
Hmm.
and undernourished,
Hmm.
and you've got the bacteria coming down the tooth tubules, then that's where decay comes from. All
Wow. So
my
the
eye decay
yeah.
patients all have vitamin D levels in the teens and 20s, low 20s.
Hmm.
So whenever I have somebody who has decay, they need to go see their primary care provider to get blood work. We've got to address nutrition in
Hmm.
dentistry. That is the foundation of dental health, is nutrition.
Wow. Well, Dr. Weston Price figured that out freaking 100 years ago.
Yeah. Yeah, he
Um,
did. He
yeah,
did. And we have not paid attention to his valuable research.
right. Um,
He's
and listening to you talk about fluoride, I remember arguing with the patient that didn't want fluoride and quoting the status quo stuff that I was given.
Yeah,
Oh, that study was about from the EPA about industrial fluoride levels, blah blah blah. And I'm like,
yeah,
oh my God, you just don't know what you don't know.
yeah. I mean, to our sadness, I mean, we just are regurgitating what we have learned
Yep.
and what we were told. And I trusted the ADA, and I trusted the ADHA to give me good information.
Mm-hmm.
But what I have since decided is that I was lazy. And
Ooh.
yeah, and we are, we're just regurgitating, you know, it's like a bad game of telephone,
Yeah.
from kindergarten. And we're still, spouting the garbage that we learned, 30 years ago.
So, lazy. That's a strong word.
It is. Well,
But in order to admit that I'm lazy, I have to first um, realize that there's something that I don't know. I mean, you
yeah.
got to have that. It's like a spiritual awakening. Like,
Mm.
wow. Oh, like I just had listening to you about fluoride, you know. So now that I know that, it's incumbent upon me to exert the energy to look into that more.
Yeah.
Um,
We need to all do our own due diligence.
yeah,
No,
yeah.
look up fluoride and skeletal fluorosis on Google Scholar. Look up fluoride and IQ. Look up fluoride and thyroid. Look up fluoride and babies
Mm-hmm.
and development. And look up fluoride and bones. Look up fluoride in your joints.
Mm-hmm.
Well, we we were told that, well, skeletal fluorosis only happens in like India and China, where they have high levels of fluoride
Yeah.
in their water. And but we can have, whenever you see fluorosis, and 40% of our children in the United States have fluorosis,
Mm-hmm.
that is an outward sign of inward fluoride toxicity. And what happens in the teeth is also happening in our bones, and that is skeletal fluorosis. So maybe it's not the same level as in China and India where you have
Mm-hmm.
deformity, but fluoride causes skeletal fluorosis, and that mimics arthritis.
Wow.
And how many of us have arthritis?
Right. And
And
we just assume it's part of the aging process, right? I'm 62
it,
and
yeah,
and that's what we're told.
yeah.
That's what we're
Well,
told.
and instead, what if the skeletal fluorosis that we see, and I see it a lot
Mm-hmm.
in my patients, in my littlest littles, and even in adults, and that mimics arthritis.
So,
And we have an increase in hip fractures. Fluoride makes the
yes,
bones hard but brittle.
but brittle. So if a person comes to you, that's I want a little kid with just
Yeah.
with fluorosis in their bones. What does that present like?
Well, I mean, we see, just white streaks in the teeth.
Mm-hmm.
Whiter streaks, spotting
Mm-hmm.
in the teeth. And I've had some patients with severe fluorosis, and that is pitting
Mm-hmm.
and breakdown of the
Wow.
enamel. It damages the enamel. It makes it hard. Yes, it does, but it makes it brittle. And there is research that shows that severe fluorosis actually increases tooth decay.
Wow. So when I moved lived in Colorado, out there, they're like,
Yeah,
it's the fluoride out here, and teeth are hard as rocks.
yeah, yeah.
And
Okay, well,
I
mm,
guess, well, they are, but
yeah, well, they're hard but brittle.
yeah, but no. And well, Colorado's all full of people that weren't from there anyway.
Yeah.
So wow. So systemic fluorosis can feel like, so you have little kids who like are sore, pain, like joint
Well,
sore and
I'm not seeing pain in them,
Mhm.
but it's cumulative.
Yeah, yes. Okay.
But seeing that sign of fluoride toxicity,
Mm-hmm.
and I know that 20 or 30 years from now, that's going to show up in as arthritis.
Wow. And look at all these autoimmune diseases that are rampant. You
Yeah.
know, the when you have fluoride, but we also have all this bacteria that's in the mouth that's flooding your bloodstream, right?
Mhm.
And
Oh,
if
yeah.
if these bacteria, they're not supposed to be in your bloodstream. So if they're, this is my, I always wonder about this. If they
Yeah.
are producing acid in the mouth, aren't they also bringing acid to the bloodstream? So you have systemic acidosis, and
Mhm.
the body can't function in a non-neutral pH.
Correct. Yeah.
So then the immune system's like, what's going on?
Yeah. And you're right. We are creating bacteremias. If we are putting our scalars in these cesspool pockets that
Mm-hmm.
are filled with spirochetes and parasites, we are introducing these bacteria into the bloodstream and into the gut and into our lungs.
Mm-hmm.
And we are creating systemic issues.
Wow. So
And
yeah.
and think about dementia. 90% of our dementia patients on autopsy have spirochetes in the brain.
When I was a nursing assistant in 1978 at the Beechwood Nursing Home in Rochester, New York, none of those people had teeth. Okay, they all had dentures. Now, then people born in the 40s, especially, and after that, they have teeth. So they've kept their teeth. So they've kept this bacteremia their whole lives. And
Mhm.
then, oh my God, don't even get me started on nursing home oral
Oral
care because
hygiene
it doesn't exist.
doesn't
So
exist.
these people have these septic mouths, and
Yeah.
so their bloodstream is consistently flooded with these
Mhm.
bacteria that find their way to the brain.
Yeah, they do. They do. And our spirochetes make the same biofilm in the brain that they do in the mouth.
Mm-hmm.
And the what the research is showing as one contributing factor to dementia is that the brain is making the beta amyloids and the tau proteins to protect itself
Mm-hmm.
from the toxins from our periopathogens.
Wow.
And, how does the brain clean it out? Well, if we're not sleeping, we're
Right.
not getting that lymphatic flushing every night.
Wow.
And so our people that are only sleeping 3 to 4 hours
Mm-hmm.
because fluoride calcifies the pineal gland. So we're not getting melatonin.
Oh my God. Wow. Oh my God.
It
So the
everything is affected. It's like dominoes just going out. Every piece of us is affected by fluoride, by mouth breathing, by nutrition. And until we get to the root of the problem, this is going to continue.
so
And
yeah, so we have to stop. Okay, we have to stop the fluoride. We have to
mhm,
stop with the Listerine.
yeah,
Listerine's like napalm, right?
yeah, it kills everything. So then if we kill all the bacteria,
Right.
that means we're killing the good bacteria as well.
Mm-hmm.
And
Right.
we need good bacteria to make nitric oxide.
Yes.
And we can't heal without nitric oxide.
Yes. And between mouth breathing and this dysbiosis, yeah, we're severely deficient in nitric oxide.
Mhm, yeah.
And wow. So like how are we even alive? That's what I want to know. Like how are we
Well,
it's
we're
kind of, I was talking about this yesterday. So the body's uh capacity to compensate is
yeah, is incredible.
miraculous.
Yeah.
It's
But
miraculous.
most of us have, by the time we're 65, we have 8 prescription medications. By
Mm-hmm.
the time we're, what, 80, we have 16.
Yeah.
So, we are staying alive through pharmaceuticals.
Right.
But, is that a healthy? No, it's not. It's not healthy. We are living with chronic disease.
Mm-hmm.
And the root of all of our chronic disease is hypoxia. So it comes back to oxygen.
which comes down to why we're traumatizing dental patients, because they can't breathe.
They can't breathe. They can't.
And this so my message to my fellow professionals is, you can learn to spot the signs, the behaviors of a patient with a deficient airway. You can look at them in the waiting room and you can see, do they have forward head posture? Are they slumped? Are their shoulders slumped forward? When, so when I call the patient in, when I call the patient into the waiting room, are they breathing with them? I mean, these are all, instead of waiting till they get in the chair and then getting in an argument with them about these x-rays that they don't want, which really is about they can't breathe.
Yeah.
They'll say, well, Dr. Oz says they're bad, or, I don't want to pay for them, but it really is, I don't want these x-rays because I can't breathe, because I gag.
Yeah.
And throughout my course of my dental history, I've been shamed for that response. And you can learn. I mean, I figured it out. It can't be that hard.
It's not.
You can learn. I mean, I learned to spot these things, and look at the previous x-rays. If the patient can't close on their previous x-rays, instead of complaining about the previous hygienist that took these crappy x-rays, how about realizing, oh, they can't close?
Yeah.
And sometimes that crappy hygienist was me.
And me.
Yeah, because
I know.
patient, but if I look, if the occlusal line is slanted, if the patient can't close, these are both strong indications that this patient is going to have a hard time with x-rays. So I can be proactive, right? When I'm getting the patient ready to do these exposures. Oh, I wonder if you have a hard time with x-rays. Sometimes just saying that, they're like, how did you know that? Right. And instead of writing a diatribe in their chart, this patient, blah, 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 let's breathe them through their gag reflex.
Yeah. Yep, exactly.
Yeah.
Yeah. So it comes down to oxygen. It does. It starts with oxygen. Without oxygen, everything else fails.
Yeah. We don't get oxygen. We don't got nothing.
Yeah.
So, where are you speaking?
Well, next Thursday, I am actually speaking at it's an online oral health summit for Biocidin.
Nice.
And I will be speaking as part of the expert panel, and then I will also be speaking more in depth on fluoride.
Excellent.
And then in November, I'm speaking, it's already recorded. I'm talking as part of a Healthy Children Summit,
Nice.
and that will be online. And then in January, my fellow biological besties, Catherine Gilliam and Fran Horning, and I are hosting a limit 30-person hands-on biological mini residency. We're
That's
going to be in
amazing.
Houston and just really dive into how to have a biological dental hygiene practice
That's
and
amazing.
really heal our patients.
Oh my
You know,
God. I love that.
yeah.
I'm retired from clinical hygiene. Damn it.
But it's still come, Elizabeth,
Right.
because you have an important platform to share. It's
Yeah.
not just, it's not just about scraping teeth.
Mm-hmm.
You have to get over that.
Yeah.
With the new desiccation therapies coming,
Mm-hmm.
hygiene scaling is going to be a thing of the past.
Right.
We can do this more gently and less invasively with the new techniques that are coming, air polisher
Yes.
and
I love all that
desiccation,
stuff. I
and
love all
then
that stuff.
and then perioprotectrace. I mean,
Mm-hmm.
wow. That's a game changer. Those three put together is, we can be more gentle to the tooth structure.
And and create and do a good service for people non-traumatically.
Yeah.
And Wow. And people are so used to being beat up.
Yeah,
And it just, I've said this for years, but now I can really, really say it. It doesn't have to be that way.
it shouldn't be that
It
way.
shouldn't be that way.
I mean, calculus is just minerals.
Yeah.
So, why are we whittling the tooth structure away?
Mm-hmm.
And let's disinfect the calculus. We're not
Mm-hmm.
going to get every piece off, but we have ozone.
Yeah.
Ozone
Yes.
for
Ozone.
bacteria, fungi, parasites, viruses, prions. It disinfects the tooth surface. It desensitizes the tooth surface. Ozone, ozone, and a microscope. Those are my two things.
I
Whew.
love it. Now
Yeah,
that's really modern. That is 21st century cutting edge. I mean, the
non-cutting, cutting edge.
standard SOP in dental offices.
Yeah,
You and when you were talking about tooth sensitivity,
yeah,
something I noticed, so hardly anybody has a functional swallow, right? So people take a great big gulp. What do they go?
mm-hmm.
So they're like, oh, it hurts when I drink something cold or hot. Well, because everything's going out here. If
Yeah,
if people had a functional
yeah,
swallow, they would have a lot less sensitivity, because this is where the sensitivity is out
yeah,
here.
yeah.
And I've had patients where I worked with them in the chair and said, okay, I want you to swallow this. And I showed them, and they're like, wow, that didn't hurt. I'm like, yeah, that's how you're supposed to swallow. None of this billowing into the cheeks. Yeah.
Yeah.
Like, go to any Starbucks, you see lots of billowing.
Yeah. Very good. Yes, you are right. Oh, there's just so much that we can do to help our patients.
Yeah, there really is.
Yeah.
So I'm thrilled to talk to you in person. We've been communicating online and seeing each other, and it's you're an amazing, brilliant individual.
Thank you. Oh,
And
I just feel so normal. I just wish everybody knew this information. I mean,
right, right.
this is it's out. I mean, all I do is sit and read dental hygiene books
Mm-hmm.
and find out, let's find a better way to do our profession in a
Yeah,
more loving, gentle way
exactly.
and get, to the root of the problem,
Yep, yep,
which is often not in the mouth. So,
exactly, exactly. And I thank you for your time this morning.
oh, my
And
pleasure.
I might just have to show up there in Houston.
Okay. I would like
All right. Thank you so much.
Oh, my pleasure. Thank you. Bye,
You're
everyone.
welcome.